Bismillahirrahmanirrahim. My name is Dr. Fakhriyat. You are watching our YouTube channel Medical Fever. Today we will discuss about the Hodgkin lymphoma. Mainly it is a disorder of WBCs, white blood cells, and mainly it is a lymphoma. What is meaning by the lymphoma? Lymphoma is mainly the cancer of the lymphatic system. The most important is the cancer of the lymphatic system. Hodgkin lymphoma is mainly the neoplastic proliferation. If I want to be discussed with you, is the neoplastic proliferation of the Reed-Sternberg cells. What are the Reed-Sternberg cells? Reed-Sternberg cells are mainly large B cells. These are the large B cells with multi-lobed nuclei and the prominent nuclei. This is the typical example of the all-eye nuclei. These are mainly the lymphocytes, and mainly these are the B lymphocyte with the all-eye nuclei. These are the B lymphocytes are the Reed-Sternberg cells. This is the typical, these are the Reed-Sternberg with the multi-lobed nuclei with the prominent nuclei. This is the all-eye nuclei. What are the types of the Hodgkin lymphoma? We have discussed a little bit on the Hodgkin lymphoma. There are two types of the Hodgkin lymphoma. It may be a classical, which may be a cause of the 90%. Other is the nodular lymphocyte predominant. In case classical has its four types. We are discussing the classical. It may be a nodular sclerosis, mixed cellularity, lymphocyte rich, and the lymphocyte depleted. The name representation, what is meant by the nodular sclerosis? Because I want to discuss a little bit on it. Nodule formation or the tumor formation with the sclerosis. Sclerosis is the main term in which there is accumulation of the collagen fibers. Mixed cellularity, some types of the, if there are the B lymphocytes mixed with the other types of the lymphocytes, T lymphocytes, it may be plasma cell, and the sometime is the lymphocyte rich. Lymphocyte rich means increased in the level of the lymphocytes. Other is the lymphocyte depleted. Sometime lymphocytes, there is a degeneration. Lymphocytes may be depleted, hence there is bad prognosis because lymphocytes are not present, and more chance of the infection, because, and this is the bad prognosis. This is the, if there are some neurological question, if the lymphocytes are depleted, there are the more clinically risk of the infection increases. If we want to discuss on the detailed nodular sclerosis, we have discussed it, some types of the nodular large tumor cells with the varying degree of collagen or the fibrosis. In the mixed cellularity, we have discussed about with the lymphocytes with the histiocytes, eosinophil. The typical example, if there is always with the eosinophil, this is the mixed cellularity, most associated with the Epstein-Barr virus infection. Lymphocyte rich is mainly there is an increase in the lymphocytes. Lymphocyte depleted, more chance of the infection, and this is the bad prognosis. What are the staging of the Hodgkin lymphoma? We have discussed the Hodgkin lymphoma and their types. Now we are discussing about the staging of the Hodgkin lymphoma. I want to be discussed. This is the mainly typical example. These are the nodes, and these are the axillary nodes, and these are the diaphragm, liver, and here these are other type nodes, iliac nodes, maybe other supraclavicular nodes. If there is on the, this is mainly we discuss with the above the diaphragm and the lower down the diaphragm. If it is above the diaphragm and mainly involves one type of the, it may be axillary, it may be cervical. If involves the axillary or the one, this is the stage 1. In case of the stage 1, limited to the one group lymph node and mainly above the diaphragm. Second, it may involve the above the diaphragm, but it may involve the supraclavicular or the other lymph node with the two types of the lymph node. Two lymph node regions on the same side as the diaphragm, on the same side as the diaphragm, on the same side. If on the same side as the diaphragm and involve the lower down, this is the stage 3. On the both sides, superior and inferior to the, this is on the same side and superior and inferior to the diaphragm. If it is stage 4, it is the bad prognosis because it may involve our systemic system. It may involve the liver, maybe spleen, or the other types of the organ. Clinical features are the most important. we have discussed the staging. Now we are discussing about the clinical features. Present with the gradual lymphadenopathy because there is some lymphatic system, cancer of the lymphatic system, there is a lymph node involvement. That's why the gradual lymphadenopathy with the malaise and the fatigue. Fatigue is a typical example. Lymphadenopathy, a typical painless. Most important, it a painless, firm in large lymph node, most common in the neck area. It may be supraclavicular or the other. B symptoms, because it is mainly because of the B cells or the Reed-Sternberg cells. That's why the B lymphocytes, what are the symptoms? Number one is the fever, night sweat and the weight loss. If there is a weight loss, because weight loss is a condition, it is a typical example of the cancer. If someone is losing the weight without and with food, if he is taking food but he is losing his weight, that is the typical example of the cancer. And in this there is a night sweats and the weight loss with the mediastinal mass, pruritus. Why the pruritus? Inflammation in some type of the lymphocyte depleted. Hepatosplenomegaly, if it involves the hepatic system, malaise and the fatigue. These are the, if it is lymph node involvement, lungs involvement and can lead to the cough, night sweats, skin itches, spleen enlargement and the bone marrow involvement. Bone marrow involvement is the most dangerous condition. What are the diagnosis? Because we want to discuss about the diagnosis. It may be the CT scan on the X-ray. This is a CT scan and this is the X-ray. These are the area of the lungs. I will be discussed with you in that. These are the mainly lungs area, and here this is the mediastinal nodal mass. These are the mediastinal nodal mass. I want to show by this diagram. This is the heart, and above the heart it is the mediastinal lymph node. Here in this CT scan there is a mediastinal malignant nodes involvement. In case this is the X-ray and this is CT scan. PET scan. PET scan is the positron emission tomography. Other is the lymph node biopsy. Lymph node biopsy is the most important. It may be the fine needle aspiration, and other is the bone marrow biopsy. Bone marrow biopsy because this is the condition in which taken a sample from the bone marrow. This is the bone marrow biopsy. We have discussed the mainly we have discussed the Reed-Sternberg cells, then we have discussed the classification, then staging, then the clinical features, diagnosis. We are the most concerned about the treatment plan of the Hodgkin lymphoma. It is the medication rituximab, mainly because of these are the monoclonal antibodies for the nodular lymphocyte predominant Hodgkin lymphoma. This is mainly the nodular lymphocyte predominant. These are the 10% of the, we have discussed previously, these are the 10%. Chemotherapy and the radiotherapy, and in classical Hodgkin lymphoma, these are the totally 90%. In case of the lymphocyte predominant Hodgkin lymphoma, we are using the rituximab. These are the monoclonal antibodies. Other is the 4 chemotherapeutic agent. This is the 2 classification for the treatment plan. Number 1 is the ABVD and other is the Stanford 5 chemotherapy regimen. Number 1 is the ABVD. This is the doxorubicin and bleomycin, and that is the dacarbazine and the others. But in case of the Stanford 5 regimen, this is, you may remember, this is the doxorubicin, bleomycin and vinblastine and dacarbazine. In case of the advanced stage, refer to the 3 or the 4 stage, disease may be aggressive. There are the Stanford ABVD. These are the 2 treatment plan of the Hodgkin lymphoma. That we all discuss about the Hodgkin lymphoma. We have discussed later on. Thank you so much. Allah Hafiz. Please like and subscribe our channel Medicos Fever.